Hello, I'm Dr. Triranjan Basu. I'm a senior consultant radiation oncologist in HCG Mumbai. Today, we are going to hear and learn about how bladder cancers or urinary bladder cancer can be managed by modern day radiotherapy technologies, where we can cure the disease as well as maintain the normal bladder. So, this itself is a doubt among a lot of people. Traditionally, bladder cancers or tumors in urinary bladder been treated by surgery. That means removing whole of the bladder. Now, what happens by that? Even if you're able to tackle the cancer, you are left the patients with an urinary bladder artificial bag for rest of their life. Means they will be able to pass urine only through a bag connected through their abdomen. So no more of a routine way how a people would pass their bladder otherwise. So every time there is some inconvenience related to it, you'll have to carry a bag at times full of urine in your daily activities. So is it really helping them in their quality of life? Even worse, by doing this also there is no foolproof guarantee that the disease can never come back. So then why to subject someone to this harsh treatment? In today's time, when patients are fit and they have undergone an adequate or we say maximum safe resection of the bladder tumor, the remaining bladder retaining their normal bladder capacity, retaining the way they would pass urine normally, and treat them with radiation and chemotherapy if they are fit. This approach is called bladder preservation approach, where we tackle the bladder cancer by side, we also retain the normal bladder functions. So we can cure the cancer when patients will be able to pass urine normally. This improves the quality of life and also gives a similar cancer specific survival that they would have otherwise got by removing whole of the bladder. So what it requires a lot of awareness is in the first place. So one needs to know that there is option. If you have an urinary bladder cancer, it's not you always have to sacrifice your entire bladder. There can be surgery to the safest extent, of course, as the first step, and then to supplement or to retain the normal bladder, we add modern day radiations with chemotherapy. Now these radiations will be long radiations and nothing basically treating by high energy X-rays, focused by an image guidance, something we call image guided intensity modulated radiation. You give high dose to the remaining bladder and also cover pelvic nodal regions. This would ensure that the local disease remains controlled as well as we prevent disease coming back elsewhere and give them an overall survival benefit. Radiation is long in that way. People have to come for about 5 days in a week for close to 5 to 6 weeks, and weekly some of the days they will also need chemotherapy if they are fit to tolerate along with radiation. Now nothing comes free of side effect definitely. As surgery would cause a change in the quality of life, radiotherapy with or without chemotherapy would also add some sort of acute and late side effects. Now, usual acute side effects would be an increase in urine passage, at times maybe some burning, at times with low appetite or loose motions. The crux of it, radiation is a local therapy, so the side effects would be related to the organs in and around bladder. Most of the time, they would be rectum and small bowel. Now, there are ways to tackle that. There are medicines to give while people develop these side effects. And the key point is nothing is going to be permanent. These are all have a temporal correlation. After certain amount of days to weeks, the side effect would settle and patients would return to their normal activities. So yes, every treatment comes with some sort of side effect, but it is important to be aware that not only always some heroic or some dreaded surgery can cure you. There are non-surgicals or non-operative equally effective methods to control your disease and a disease like urinary bladder cancer. So important is to be aware of the other treatment options. Thank you.